Hi, I'm Sarah Blair from Indie Practices. One of the most common questions that we get is about case acceptance. And honestly, helping patients move forward with treatment is an entire team effort. So I really recommend watching this at the start of a team meeting together. I would also download the document that you'll find in the notes. There's a link there, and share it with your team before watching the video together. So, what is case acceptance? Basically, it means helping patients move forward with treatment. I really like the acronym CARE, CARE. If we truly care about our patients, we need to help them move forward with the dental care they want and need. It doesn't matter how great our dentistry is if patients aren't getting it done. This is not about selling, it's about communication and clarity. So the C in CARE stands for connection, and this is all about building a relationship with the patient based on trust and understanding. It should start with the first clinical team member, asking open-ended questions, listening carefully, and rephrasing them back, and following up for more information. It could sound like this. I see from our notes that you're concerned about some cold sensitivity on the upper left. Is there anything else that brings you in to see us today? Or tell me more about the situation with that missing tooth. Listen more than you talk. The goal is to understand the patient's motivations, goals, and sense of urgency so that we can create a treatment plan that's best for them. The A is for awareness. This is about making sure patients are aware of the problems in their mouths. And the very best way to do this is with photographs up on a screen and talking about them together. Don't use technical dental terminology or confusing lingo. Keep it really simple with normal words that people understand. Analogies help a lot too. So it could sound a little bit something like this. Hey Mindy, I just took this photo of that molar that you were worried about on the lower right, and I can see there is a big crack running down the side here. And it does look like the old filling is breaking down a little bit. That's why there's that sharp edge that you noticed. I'm a little concerned about this one, so we'll have Dr. Brown take a look when he comes in. So the R in CARE stands for risks and benefits of treatment. And I don't mean this in a technical sense as far as liability. I mean it in the sense of tapping into what the patient shared with you is important to them. So it could sound something like this. You know, Mary, I know you told me that you really don't want to lose this tooth because you're worried about not being able to chew. And you want to make sure that you can save it for the future. The good news is we can help you by treating the infection that's here and making the tooth stable so that you're going to be able to eat all your favorite foods in the future. E is for establish a plan, and this is harder than it sounds. In the course of the conversation, you want to be narrowing things down from all the options that are out there to the options that are truly best for this patient based on what they've shared with you. So by the end of the conversation, you should be able to say something like, based on what you told me about this, it sounds like this is going to be the best option for you. Let's make a plan to move forward with this. The first appointment will be da 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 da. So that you're guiding the conversation. Sometimes we try to present too much information and we confuse and overwhelm the patient. The information that the patient has shared and that you gathered in your exam should be enough in most cases to make a single phase treatment plan moving forward. It's great to hear about this, but it's even better to practice. I recommend pairing up after this video and using the language together so that it becomes smooth and natural and you can use it with patients in the operatory. Thanks for letting Indie Practices be a part of your team meeting, and don't hesitate to reach out if you have any questions.